First Assisted Bowel Resections Part 2. We're going to talk about some of the benign conditions that may require surgery. So you may have a mesenteric artery infarction, which cuts off the blood supply to a certain area of the bowel, and then you end up with the bowel becomes ischemic and eventually dies and becomes necrotic. One of the instances that this happens is after AAA. And if you look in your anatomy book, I can't show you pictures because of copyright laws, but if you look at your anatomy book, you can see that the inferior mesenteric artery is often below the level of where the aneurysm is, and therefore this is the artery that's infected, that's affected by a AAA. The superior artery, mesenteric artery, and we'll talk about what these apply later, is usually intact, and that's usually fine, but it's the inferior mesenteric artery, and then it gets debris in it, and then after a AAA and it clots off, and then they have dead bowel. Another thing that you might require surgery for is a diverticulum, which is usually in the sigmoid colon or the left side of the colon, sigmoid, descending colon. And what that is where the artery and the vein come into the bowel is a little bit weaker. So you, in your bowel, especially on the left side, more of the fluid has been absorbed, so the stool is thicker there. So your body has to peristalse and push it. And the harder it has to push, the more pressure it puts on the area. And so the weaker area may end up getting a bleb, a balloon in it, just like if you had a tire that was weak and then the air would bulge it out. That's what happens, and that's what a diverticulum is. So obviously that's why it's more common in the left side, because the thicker stool is there and more pressure is needed, and then that's going to cause a diverticulum, which tend to occur as the age progresses. You get more and more of them. So you also have Crohn's disease, which results in ulcerative colitis. That one is usually on the right colon that affects mostly. You also may have volvulus or intussusception. So what's volvulus? Volvulus is when the bowel twists like a pretzel. Intussusception is when it telescopes in on itself, and frequently when it telescopes in on itself, it's due to some tumor that's inside the bowel that's pushing it and making it telescope on itself. Then you also have an internal hernia, which may be causing a bowel obstruction, and sometimes an internal hernia. I was doing a case with a colorectal surgeon once, and we were looking for a while because we knew that there was a bowel obstruction, but you couldn't really find anything that was obvious. And what we ended up finding was a little strand that would be about the size of the rice noodle, the little tiny angel hair noodle. That a little strand this much between two pieces of bowel, and that was enough to cause an obstruction. So it doesn't always take much to do. You may have a perforation, and by that they would have seen free air in the abdomen, which would be another part of the lab workup. Do they have free air? If there's free air, there's a hole in the bowel somewhere, and that air is escaping from the bowel into the abdomen. These are all benign procedures. So what does this tell you as a first assistant? If you're going in to do the surgery with a surgeon, you know that because it's benign, the surgeon does not need to, he's going to try and preserve as much as he needs to, as he can, because he doesn't need to take margins. He doesn't need to get the nose out. So it's not going to be as involved as if there was a malignancy. And you as an assistant know that he's only going to take out the part of the bowel that's been affected by whatever disease process is going on. You also have two precancerous ones. They may have polyps, or one of them is like a villus adenoma, which can become cancerous. The villus adenoma, and I'll show you a picture of that. In fact, let me show you now. So this is a villus adenoma, and you can see how it's blobby, and sometimes it's got a lot of little, it's like a fish roe, in where there's little blobs of little polyps all clustered together, and it's kind of flat. So sometimes it's hard to feel when you go in and you're trying to feel through the bowel to see where the villus adenoma is, and it's not real obvious. So these are the benign conditions that you may have.